Okay, guys, tonight is a bonus show for you. The topic is hospice care myths, finding comfort and meaning, finding comfort and life's meaning. Okay, here we go with bonus E for you. Okay, on your open page is the title of a short video segment featuring Matt Fraser, and the surrounding content makes its purpose very clear. Here's a grounded explanation based directly on what appears on the page. What the title means in the context of the page. The title signals that the video is about correcting common misunderstandings about hospice and reframing hospice care as something that brings comfort, dignity, and meaning at the end of life. The page content emphasizes that Fraser is explaining the truth about hospice care and how it enhances life, which tells you the segment is meant to reduce fear and replace myths with reassurance. What the surrounding page content highlights. The page repeats a few key ideas that shape the meaning of the title. Hospice isn't about giving up. It's about improving the quality of the time someone has left. The page notes that Fraser explains the truth about hospice care and how it enhances life, which directly counters the myth that hospice is only about dying. Comfort and dignity are central. The description says the message reveals the dignity of end of life support, underscoring that hospice focuses on comfort, respect, and emotional grounding. Myth busting matters because fear is common. The page explicitly states this matters because it dispels fear, showing that the video's purpose is educational and reassuring. Meaning making is part of the experience. The title's phrase, finding life's meaning, signals with Fraser's broader work on healing and connection, which the page reinforces through links to his other grief supported content. how the title fits the overall message. Taken together, the title tells you there are misconceptions about hospice that keep people from understanding its value. Hospice can be a source of comfort, not just a medical service. Even in the final stage of life, people can experience connection, purpose, and meaning. The video aims to reframe hospice as a compassionate, life affirming support system. Here's a clear, grounded explanation of the text. Hospice care myths versus truths you should know, based directly on the content of the page you have open. What the title signals. The title tells you that the page is designed to correct common misunderstandings about hospice. And replace fear with accurate, reassuring information. It frames hospice not as a last-minute crisis service, but as a supportive, life-enriching, or life-enhancing model of care for people nearing the end of life. The surrounding page content reinforces this by walking through specific myths and offering clear, compassionate truths in response. What the page emphasizes: myth, hospice over medicates patients. Truth: medicines are chosen carefully to manage symptoms, not to sedate or hasten death. The page stresses that patients often remain alert and able to enjoy meaningful time with loved ones. Hospice is described as helping people live well, and the page even notes that some studies show people may live longer with hospice. 2. Myth: calling hospice means giving up. Truth: hospice shifts the focus from cure to comfort, peace, and quality of life. The page highlights that families often say they wish they had called sooner because Earlier support allows more time for connection and memory making. Myth: hospice is a place. Truth: hospice is a type of care, not a building. Most care happens at home with inpatient facilities, used only when symptoms become difficult to manage. 4. Myth: hospice staff move into your home. Truth: the hospice team visits regularly but does not live with the family. The page lists the interdisciplinary team: nurses, aides, social workers, chaplains, music therapists, volunteers, and emphasizes that families are supported 24/7 by phone. Myth: hospice is only for the last days of life. Truth: hospice is intended for the last 6 months or sometimes longer. Starting earlier helps families live again, not just wait, as the page puts it. The deeper message the page conveys across all the myths and truths. The page is communicating a consistent theme. Hospice is about comfort, dignity, and making the most of the time that remains. It supports both patients and families through one of life's most important transitions. Waiting too long means missing out on help that could ease suffering and restore a sense of living. Hospice is not about death, it's about living well every day, even at the end of life. Okay, third part, guys. Here's a clear, grounded explanation of the text. Hospice care myths versus facts. Based directly on the content of the page you have open. What the title signals. The title tells you the page is designed to correct common misunderstandings about hospice care. The surrounding content makes it clear that the goal is to replace fear and hesitation with accurate, reassuring information about what hospice truly offers: comfort, dignity, and quality of life for people with life-limiting illnesses. The page explicitly states that misconceptions can delay essential care. So the myths versus facts format is meant to clear away confusion and help families make informed decisions. What the page emphasizes through each myth and fact. Myth 1: Hospice is a place where people go to die. Fact: Hospice Isle of Man provides palliative care throughout an illness, not just the very end. Many people receiving hospice support are not in their final days. Myth 2: Hospice care is only for people dying of cancer. Fact: Hospice supports anyone with a life-limiting condition, including COPD, renal failure, motor neuron disease, and others. Myth 3: Only the person who is ill benefits from hospice. Fact: Hospice provides emotional, psychological, and practical support for families and carers, as well as patients. Myth 4: Hospice care is only provided in a hospital or hospice facility. Fact: Care can be delivered at home, in care homes, or hospitals. Hospice teams work closely with GPs and community clinicians and often visit patients where they live. Myth 5: Hospice care is just about medical treatment. Fact: Hospice takes a holistic approach, offering therapies that support physical, emotional, and spiritual well-being alongside medical care. Myth 6: Pain is part of dying. Fact: Pain is not inevitable. When pain does occur, hospice teams have many ways to manage it so patients can rest and relax. Myth 7: Hospice care means all treatment stops. Hospice does not require stopping all other treatments. People can continue recommended care unless they choose otherwise. Symptom management remains a priority. The deeper message the page conveys. Across all the myths and facts, the page is communicating a consistent theme. Hospice is not about giving up. It's about improving quality of life It supports patients and families together, not just the person who is ill. Care is flexible, meeting people where they are, literally and emotionally. Hospice is holistic. Hospice is a holistic, compassionate model that prioritizes comfort, dignity, and informed choice. Understanding the truth helps families across or access support earlier when it can make the greatest difference. Okay, guys, those are your shows for the night. I will be on tomorrow afternoon. Until then, Gator Wellness, take care, folks. Have a good evening.